Hi, I'm Ashton Hayes. I am an accredited mental health social worker and clinical supervisor in private practice. I've been in private practice for about 10 years now, and something that has come up a lot in the time that I have been working in that space is questions around whether or not a social worker can be a mental health clinician. Now, sometimes what comes up is just a lack of knowledge around the diversity of social work and the huge array of services that we can offer. And other times it can feel a little bit disparaging. Oh, I thought you were just a social worker. Oh, I actually wanted my client to see a psychologist. Or I think a psychologist would be better at that. Very early on in my career in private practice, I had a medical doctor refuse to give the client a mental health care plan because that doctor did not want the client to see me. Now, the client had been referred to me by a clinical psychologist who knew that at that time I was specialising in working with children and young people, and she had asked if I could see this client for her. But when we went back to the GP to get the mental health care plan, the GP was incredibly angry and insisted that she wanted the client to see a clinical psychologist. I explained the situation, and the GP was adamant that I would not be able to support her client. Ultimately, the client decided to pay privately, and I was able to support that client for some time. The difficult situation there was that the GP was not even willing to have a conversation with me. And I think that that did a disservice both to her and to her clients, because when there are long waiting lists, oftentimes people will search psychologist, not accredited mental health social worker. And this means that a well-informed GP and other services will know that they can send their client to us. I've also had situations with my supervisees who've been told that social workers can't or shouldn't do mental health work. I'm always a little bit frustrated when this happens. And earlier on in my career, I probably was a little bit feistier in the way that I responded. But these days, what I say is, I'm curious to hear a little bit more about your opinion on that. Can you tell me why you think an accredited mental health social worker or a social worker working in mental health would not be capable of handling that particular client situation? And oftentimes it's simply a lack of understanding. But you're a caseworker, but you do community work, but you do family support work. And rather than making that a big fight, which, let's face it, depending on how annoyed we might be feeling that day, it can become a little bit of a tense situation. I really like to lead with curiosity, because it also then leads to a conversation about what it is that we do, what it is that we offer, and how we can work together. We don't need to be in competition with each other. There are plenty of people out in the world who require support. The way in which we support may have a different framework and different lenses, but those of us who are working in mental health are still trained as clinicians. We still understand diagnoses, diagnostic criteria. We understand clinical presentation. We understand that there are particular interventions that are evidence-based and recommended for whatever client presentation is coming before us. And I think even more importantly, we understand our scope of practice. And so there are some of us who don't work with children. There are some of us that don't work with older people. Some of us who don't work with domestic violence, and some of us who do. So I think in order to keep the conversation going and create a more friendly and a more information sharing space, asking people about why they think the way that they think, and then educating them on why we are in fact a really good choice for a lot of people, is a really good idea. I know that we will still be faced with issues, particularly I feel like even more so now, given that we have had South Australia not continue through with registration. And given that we are still in 2026 fighting for protection of title, we are going to come up against these obstacles. However, it is on us as clinicians, as social workers, I think, to continue to educate, inform, and create a space for respectful conversation about how we all as clinicians can work together rather than trying to work against each other.